there many others you're expecting, Louise?
About 40 that have signed up, but
Okay.
I think maybe we're 3 minutes past, and we'll just start with the introductions and then the sort of rules of engagement. And I can always put the rules of engagement in the chat again to let people know who join us a bit later. So I'll start then. I'm Louise Banks, and I'm Head of External Affairs for Mid and South Essex Foundation Trust. And I support the team in our engagement events like tonight and in communicating about the community diagnostic centres. And I'll hand over to George to introduce himself.
Yes, I'm George Watson. I'm the project manager supporting the CDC programme across Mid and South Essex hospitals.
Thanks, George. Farhan, do you want to introduce yourself?
Yep. Hi, everyone. I'm Farhan. I work for the Trust as an External Affairs Officer, and I'm just facilitating the event today. Thank you.
Thank you. Perry?
Good evening, everyone. I'm Perry Hegarty. I'm Head of Capital Projects Delivery for the Trust. So we're working with NHS Property Services to deliver the construction works. Thank you.
Thanks, Perry. Andrew?
Yeah, thanks, Louise. Andrew Johnson, WT Partnership, Project Managers for the building works on behalf of NHS Property Services.
Thank you. And last but not least, Paul.
Thanks, Louise. Hi, everybody. My name's Paul Jones. I represent NHS Property Services, and I'm the Regional Capital Projects Lead covering the Midlands region. So our role is very much that we, the current or existing St Michael's Centre is owned by Property Services, and we're supporting and working collaboratively with Perry, George and the wider MSE team in the delivery of the CDC.
Thank you. And I see Kate's now joined us. Kate, would you like to introduce yourself?
Hi, everyone. Kate Butcher. I'm the Deputy Alliance Director for Mid Essex.
Thank you, Kate. So how it's going to run tonight, basically we'll be offering a presentation. You'll hear from George around the programme. You'll see some of the designs, and then you'll hear a bit about what's going to go into the centre, how you'll be able to access it, and then following that we'll be able to answer questions. So the people that have introduced themselves tonight are your panel of people that will be able to help you answer any questions. Anything we can't answer tonight, we'll take your name and contact details, and we'll come back to you with an answer. Just some rules of engagement here. I'm sure you will be, but please be respectful. So don't talk anyone down or try to shout over people. If you want to ask a question, you can raise your hand. There's a little hand right in the middle at the top of your screen that looks like a hand doing that. That's how you raise your hand. Or you can put your answers in the chat function. Again, that's the button on the left of where it says people. The admin, that's Farhan, he will unmute you so you can ask your question. So do please introduce yourself before you ask a question. And this meeting is being recorded so that others can see later, and we'll put it up on our website so people that haven't been able to make it tonight will be able to see and hear all the information. Okay, I think we're ready to move on to the next slide.
Yes, I'm happy to take over from here. So a bit of background, the Community Diagnostic Centre programmes are nationally funded programme to increase diagnostic capacity across the country. The idea is that these will be new one-stop shops and diagnostic hospitals for checks, tests, scans. And the idea is that they'll be right in the heart of local communities, providing greater access and hopefully really reducing travel times for patients needing to attend their diagnostic tests. National funding is in place for the proposed centre here at the St Michael's building on the Braintree Community Hospital site. And we have two centres, other centres that are already funded across Mid and South Essex, one in Pitsea and one in Thurrock. And we aim to have the centre open by the end of 2024. And there is mobile capacity on offer to provide interim CT and MR capacity while the building works take place. And we will be looking to bring some other services online before the end of 2024 as well. Next slide, please. So in terms of where would a Braintree hospital be, gives us a rough architect's drawing here. It is on the St Michael's building, which is kind of right in the centre of the car park of the Braintree Community Hospital site. The building, we are using only one section of the building, I won't say half, as maternity services will continue to be delivered from the Braintree site. Next slide. So this picture here just gives you a bit of a further out an external view. Again, these are sort of architect's impressions, but the idea is that we're trying to have a lot more natural light coming into the building, hopefully, and we'll be able to modernize the building and particularly the entrance going forward. And next slide, please. This just gives you an indicative site layout and hopefully shows some of the plans in terms of the general landscaping, trying to brighten up the site and also make sure that we maintain or increase car parking facilities as well. Next slide. So in terms of the services the CDC will offer, you see there's MRI, CT, ultrasound, blood tests, heart and lung tests, which will include things like echocardiograms. There'll also be dermoscopy on offer at the site. Appointments will be offered 7 days per week, and the centre will be open from 8 AM to 8 PM. Not all services will be open 7 days a week, 8 AM to 8 PM, but the majority will be. And X-ray facilities are to remain in the Braintree Community Hospital. And as mentioned previously, there will be mobile capacity offering MRI and CT scans until the CDC is open. Next slide. Benefits of CDCs to the residents. So the community diagnostic centres will help us deliver new ways of working. This centre alone will offer over 50,000 diagnostic tests per year to local residents, which will allow us to provide earlier diagnosis through easier, faster and more direct access to the full range of diagnostic tests, with the goal, of course, of improving health outcomes. By separating elective and emergency care, we hope these centres will reduce waits and will divert patients away from the busy acute sites. So community diagnostic centres will be able to focus on outpatient and routine activity, while the inpatient sites, the emergency departments, will be able to focus on our inpatients and our extremely unwell patients. It will also hopefully reduce the number of cancellations and delays patients experience when attending an NHS site. And of course, it will be bringing more diagnostic services to Braintree, allowing residents to receive tests a lot closer to home, hopefully. Next slide. So in terms of what's next, the building works are to start in early 2024. We will aim to keep disruption to a minimum to the existing services on the site that are remaining, but of course, there will be some unavoidable disruption. We have considered car parking to support additional appointments, and we've done analysis on this and believe there is sufficient space on the site to enable everything that we're planning to do. We're working with the council on options to extend public transport access, with the aim of the building being completed by the end of 2024. In terms of accessing appointments at Braintree, appointments for tests and scans will go through your usual routes of how you access hospital services at the moment. So that's either via your GP, your consultant, or a hospital doctor. You can choose which centre you want to book your appointment at via Swift Queue, Choose and Book, and those types of systems. It's going to be really important to us that this is about increasing patient access. So you'll be able to access any of the community diagnostic centres that are most beneficial to you. But of course, hopefully being in Braintree, lots of Braintree residents will take up use of the St Michael's site. Test results will be reported back to the person who asked for the test to be carried out, and parking at Braintree is to remain free even after the development takes place, which hopefully a lot of people will be pleased to hear. So if you have any questions, please raise your hand or put a question in the chat. I'll start to facilitate those and bring the team in so we can get those answered. And if you would like to feedback on the service, there is a questionnaire which you can scan the QR code there and give us some direct feedback that way as well, if you're shy or would prefer to send feedback in writing. Yes. So it's Councillor Susan. Oh, 1 second. Farhan, are you unmuting people?
Yep, I've just unmuted Councillor Susan.
That doesn't appear to be working.
Councillor Susan, you'll just have to enable your mic from your end.
I'm getting the question will come in the chat, I believe. So in the meantime, is there anyone else that wants to raise any questions initially, or any other queries for the team? So I volunteer with a charity here in Help Essex who use some of the rooms 3 times a month at the St Michael's site. What is the disruption likely to be? Noise and needing to move rooms. So that's come from Astrid. So Astrid, there certainly will be a lot of noise, dust. I would need to understand which rooms it is you're using. If you're using rooms that are currently being are going to be remodeled and redeveloped, there will be a need to relocate you, and we have a group that are looking at finding suitable space nearby, either in the main St Michael's Community Hospital building or in other alternative sort of suitable locations for services to move into while the building works take place. So I'd need a bit more information to be able to say exactly what the disruption will be. But if it's in part of the building that we're trying to keep services remaining, it will be in terms of dust, in terms of noise. If it's in part of a building that's being completely remodeled, there will be a period where, of course, we'll be looking to decant those services into other local buildings. So then Councillor Susan's question around parking. So car parking analysis has been completed at the site, and there's a number of actions we're taking to improve, one of which includes creation of 14 additional parking spaces, and there is a steering group that is used to oversee and take forward this Braintree work. And some of the recommendations that come from that steering group after a detailed discussion of parking at the Braintree site is that we will be pursuing off-site parking options with the council. There's been some really good suggestions, and we've worked that through with the operational team. And actually, those, although they're off-site, they're actually closer to the St Michael's building than it would be to walk, say, from the acute site car park to the diagnostic services that we have on the acute site. So those were deemed appropriate, and we're going to be exploring those. We are going to consult with staff and the staff parking area to see whether that can be open access for all. One of the least utilised areas at the Braintree site at the moment in terms of car parking is the staff car park, due to a number of reasons. Firstly, it being towards the back end of the site, but also because at the moment the access is actually limited even for staff. Some staff don't have access, so we may be opening that up, which would significantly increase parking for the general public as well. We're going to look to install additional signage with the goal of making it clear that parking is only for hospital use. We have had some feedback that people are concerned that actually local residents are using the car park when they go to their shop or what have you. So we're going to try and make the signage really clear on which spaces and which parts of the car park should be used for which services, which will hopefully create a differentiator between the GP and primary care parking spaces and the community diagnostic spaces as well. And we'll continue to develop additional public transport options. As I say, this did lead to us doing some analysis, and we believe even with the additional turnover that there is sufficient parking at the Braintree site. But we do understand, particularly at some peak hours, rush hours around school drop off and pick up time is a particular issue. But unfortunately, there's only so much that we can do on the site at the moment. So hopefully that answers that question. And in terms of how climate friendly would a new building be, I would have to hand over to Paul and Andrew here before I bring Marion in.
Yeah, I mean, in terms of green credentials, the redevelopment, reconfiguration of the building is going to be in line with the BRE's BREEAM standards. So there's a requirement to meet a very good standard for refurbishment, and that's what we're targeting, and that's what we're currently looking at achieving.
And then there was just one final point from Councillor before I move on, about there's no direct access from Witham, so I'll only have to pay for a taxi. We are looking at patient transport and pulling together a sort of public transport group that are going to look into that. And I haven't got an answer to what the solution will be for Witham right now, but it's certainly something that I'll make sure is on the agenda for that group to look into when we start to discuss new public transport routes. Louise and Farhan, hopefully we can make a note of that as an action for us to take forward. Marion.
Oh, hi, I'm the chair of the Friends of Braintree Community Hospital. One of the things that we have fought and failed to achieve is to get some sort of signage, particularly along the A120 to Braintree Community Hospital. And I don't know if you have the powers to do that, but it'd be great to try and help people. You know, once you know where it is, you know where it is. But if you're going to have lots of people who don't normally go there and don't know Braintree, and also to support the question on transport, because although there are routes into Braintree, they don't interconnect with the hospital. And for very elderly people who can no longer drive, it's quite a challenge to get to the hospital from the surrounding areas. And it's not Witham, it's Whittam.
Yeah, apologies, Whittam. Yeah, so the signage and about having some, particularly on the main roads, is actually an action that we've already picked up. We've had quite a few of the Friends of Braintree attend previous engagement events, so that is something we'll be looking to tackle as part of that public transport group. We know for a fact that the signage near the hospital and on the hospitals, the actual hospital site, isn't great at the moment. So, and that's definitely within our power to change, and we certainly will be addressing those issues. I don't know how much sway we have on further out, but it's something that a conversation that we're going to have with councillors, and I can see Andrew has his hands up.
You have to engage with highways, unfortunately.
Right.
Okay, thank you.
Yeah, I think Andrew may and Paul may have something to add there. Yeah,
I was just going to add, George, to just in terms of your response. It's part of the planning conditions. So we've recently achieved planning permission, but one of the conditions is around signage on site. I'm not going to say that extends beyond site, but that's certainly one thing that will need to be looked at as per planning approval.
Yeah, and there's no reason why we can't engage with highways and at least try to get some additional signage up, given the extra footfall. But again, it's not something I'm well versed in, so I don't know if Paul, there's anything else you want to add?
No, not really, George. I think Andrew stole my thunder. Really, I was hoping to give the positive news that we'd obviously secured planning permission, which was only confirmed yesterday. And I think, as Andrew has already outlined, there are some conditions, some simple conditions around landscaping, but there is issues around, I think, signage. So I think it goes hand in hand with working with the local authority. Just going back to one of the earlier questions around sustainability, Andrew made reference to the Building Research Establishment and the BREEAM acronym, which is all about sustainability and the use of buildings going forward, including energy consumption, etc. And I think from a property services perspective, even outside of the CDC development, I think we very recently put solar panels on the roof. You know, we will be looking at very simple quick wins around LED lighting, energy controls. So we are, you know, as I'm sure Perry is visibly nodding his head around our shared commitment to achieve net zero carbon as the NHS is. So there is a commitment from property services as the freeholder, alongside the development of the CTC, to make the building as energy efficient as it possibly can be.
Have we got any other questions for people to raise?
Not to raise, just to say in the chat, I've put a link. If some of you aren't able to scan that QR code, you could just click on the link and it will take you straight to the survey.
George, we've been dealing with Essex Highways on the Broomfield site, so I can pick up the thing about the signage. That would help.
Yeah, that'd be really good, Perry. If you yeah, just copy me in as well, because just for having a useful contact for any of the other schemes, that would be great.
Well, we'll have a good start anyway. Yeah. It always helps.
Surprised. Yeah, no other questions on the staffing or anything like that. Obviously, before we head off, just want to make sure there's no other questions from the group here. Otherwise, I'll hand back to Louise for any close.
Thank you, George. Yeah, so thank you everyone for coming along. It's short and sweet, but we will keep coming back and doing some regular engagement. We'll be looking to do another face-to-face thing when the building work starts, so look out for advertising around that. And as I say, your feedback, that survey is open, and it will remain open until the CDCs are open. So they will, that's an opportunity for you to talk about your diagnostic experiences at the moment, and what you'd like to see in terms of getting your results, getting there, getting you know, actually booking the tests. So hopefully that you'll find that quite accessible and easy, and please do share it widely with your friends and relatives as well, because more feedback's better than none.
And is there an email address on there that if people think of a question later on that they can get in contact with us and ask Louise if we got something?
I'll put the communications email address in. I'm just putting that in the chat, and you can get in touch with us via that email address as well, and we'll be able to support any questions you might have.
Excellent.
Okay. Right, on this wet and windy evening, we might as well draw the evening to a close. And thank you all for joining us, and we'll hope to speak to you all soon.
Excellent. Thank you all.
Thank you.
Thank you.
Thank
Bye.
you.
Thanks, everyone.